He practices in New York City. We've known each other for about 20 years. We did residency together at NYU, and a couple of weeks back he notified me that he had been struggling with COVID-19, and so he's been chronicling his recovery to a variety of different venues to help people know what to do when they're recovering from COVID-19, and we're going to ask him some questions there he is, on what's going on with where he is today and how he's feeling and what advice he has, and then we're going to be answering questions at the end of the call. Let's see if I can. It says he joined.
Mm-hmm.
There we go.
Elvis,
How you feeling?
I'm doing good, my man. How's it going down there in Texas?
Good to see you.
Yeah, I'm feeling better. I'm not. My body can't cash the checks that my brain is writing. I'm feeling like you could definitely take me in a basketball game right now.
Well, one thing that struck me most when we first started talking about this is you're probably one of the most healthy individuals that I know in terms of your devotion to a healthy lifestyle, healthy eating habits. You take care of yourself. And so
yeah,
I think that the common misconception.
Yeah. I honestly, I keep trying to figure this out, because now I'm learning there's so many people our age, and sometimes the healthier the person, the worse they're getting it. And I have to think that there is something about a strong immune system, and so much of the disease is not necessarily a pneumonia, but part of this kind of overactive immunity that's going on.
Right.
We're only going to learn this over the next several months down the line in terms of how we're going to treat this. That's why things like hydroxychloroquine, some people are using steroids, HIV medicines. I think there's going to be so much to learn. Part of my fear about going to the hospital and avoiding it is because I knew they probably don't know exactly what's going on.
Right. So, one thing that we're really struggling with here in Texas is under-testing. Under-testing is a big issue as compared to other states. And we're expecting our numbers to go up dramatically once the testing becomes more readily available. I just got off the phone with a physician-only webinar with Houston Methodist Hospital, and they were one of the first, actually the first in the country to provide convalescent plasma infusion. And I know you've been talking a lot about wanting to get tested so that perhaps in terms of your antibody levels, so that you could perhaps donate your plasma. How far away do you think we are from being able to offer that as a treatment option?
I do know in New York hospitals, they are actively using it. You have to be 21 days free of symptoms, and you have to have a negative test and something very suggestive that you had it at one point. I actually was going to have an opportunity through a patient of a friend to donate my plasma. It appears they found another donor locally, possibly. Again, a lot of people have to realize too, and this is concerned with me, I'm ready to do anything I can, donate blood, get on the front lines. But I'm not 100% healed yet. I may not be fever, I'm not obviously hacking, but my pulse oximeter, my oxygen levels are still below normal. And I get winded super easily. So if I donate blood, that may have a detrimental effect on someone who's a little still under the weather. We have to consider the people recovering.
And what day? What day would you say you're currently at?
I'm at 22. I'm at day 22. I was spiking fevers till day 12, shortness of breath till day 13, actively ill. So I've been fever free for about 8 days now. But man, it's a very slow recovery. And you know me, I'm not a sit around type of guy. My brain is like a month ahead of it already. And I very slowly walked up and down the flights of steps in my building and used 3-pound weights. And Paul, I swear I felt like I ran a marathon. I was bent over, huffing and puffing with my pulse up to 125.
Wow.
My resting pulse is like 60.
Wow.
You know, so I think it's important out there for people who are infected. Everybody wants to help too, but you know, the first rule of being a doctor or an EMT is that you have to protect yourself first. Otherwise, you're no good to anybody, right?
Right. I mean,
Are your peers and all the other clinics down in Texas, Houston, are they closed, or are there places you think still open?
I think for the most part, I mean, we're closed. I mean, physicians are providing telemedicine. You know, here we're seeing emergency cases only. We have a couple of patients coming in with infections that need to be seen. But I mean, we're talking very, very small numbers.
I mean, you hear about these private equity practices around the country, and they're like regularly open for business. It's like, it's absolutely ridiculous, not just in dermatology, but in other fields too.
Yeah. Yeah, I mean, unfortunately, it gives us all a bad name, but I don't think it's reflective of, you know, what the majority of us and our colleagues are doing. You know,
Go ahead.
No, I was going to say, I mean, go ahead.
The people down in, you know, your numbers are still relatively low compared to New York. Anyone that passes away is a significant number. But do you feel, given the numbers that you have now down in Houston, are people scared enough to not go out to the parks? Are they scared enough to have not have people coming in and out of their house? What's the state down there?
Yeah, I think we're all watching what's happening in New York and New Jersey very closely. Yeah. And I think that we're about 2 weeks behind. We're about 2 weeks from peaking. So on this call that I was just on, they were saying Houston should peak based on as you know, the curve model, which could vary based on social distancing, but they're saying around April 24th is when the peak could be here in Houston, and we could see 62,000 cases with a total, if again, based on how good we are at social distancing, by June 15th, it could reach 115,000 cases. So, you know, when you do go outside, people are staying away, and the grocery stores and the restaurants are closed, and you know, we're following the guidelines based on, you know, a lot of what we're seeing that's happening in your area.
What's the weather down there?
It's brutally hot already. It's already hot.
So, I mean, you would agree. I don't know. I really don't think, you know, like most viruses usually do better in the humidity, because the water in the air seems to shield and weigh down the virus. You know, I really don't think that's going to be the case here.
I agree.
You know, I don't think weather is going to be that. I don't think our summer, you know, if we have fewer cases during the summer, it's going to be because of the efforts that we made, not because of weather. I think we're going to be surprised, even when the numbers do come down, the new cases that'll still come up throughout the summer. And I think as long as our healthcare system could stay caught up and we can have access to testing, then, you know, we'll be able to deal with those numbers and still get back to life.
Right. So speaking of which, I mean, you know what, I know you're getting the calls as well. Everybody wants to know when we're going to be back up and running. I know your patients are dying to get in to see you.
Oh my God, it's crazy.
What are you telling your patients, you know, honestly, based on, I mean, obviously you can't predict the future, but when do you think you'll be able to?
I tell them call every week. I mean, I tell them realistically, sometime in May is realistic. You know, people are like, "Well, I'm not working. I'm not in the office. Let me do that Fraxel. Let me do that liposuction." You know, they have time, right? They figure a doctor's office is the safest place to be, other than their home, right?
Right.
Oddly, you know, not one single staff member and not one single patient that followed up by phone got sick. I was the only one.
Right.
We were wearing masks and protecting ourselves. But you know, I'm telling people to check back in May. I think that may be, you know, overexcitatory, but you know, I have people remotely dealing with the phones, and I'd rather be optimistic and cautious,
right,
than tell people, you know, no one's going to get mad if I say, sorry, we're not opening shop. You know what I'm saying? But I do believe, especially since my level of immunity, that you know, in about 4 weeks, we're going to be able to start tapering in, at least in New York, because I do believe we're reaching that peak soon. You know, people think it's just going to be a light switch. It's not going to be a light switch. It's going to be a really slow return to life,
Right.
and people just have to accept the new norm. Let me ask you, as a Mohs surgeon, are there certain people that need to be attended to surgically now, or are you able to really kind of put some people off a little bit?
Basically, it's for any lesions that are rapidly growing, we're going to see them. Obviously, if a patient has a concerning pigmented lesion that needs to be addressed, then we'll make exception, because obviously for a melanoma, you don't want to wait too long. I mean, I think right now we have a work stoppage until basically the end of the month, so we're trying to delay everything until May for the most part. But obviously, if this gets extended, then we're going to have to make some decisions in those regards.
Yeah. Are there people that that are going, right now in New York, it's like people coming out of the woodwork. I was one of the first people to really kind of come out, but now it's like a normal thing. People are just getting sick. Everyone knows someone that got sick. Has it touched home to you or Joanna at all?
Yes, it has, just because of our associations with New York.
Just people in New York. Yeah.
Yeah. I mean, and I think that the case that goes true for most Houstonians as well. Just, our hearts are with you, and it's a difficult time, and we're here to help in any way we can.
Yeah, well, I do hope that New York is setting a good example of how to battle this, because so much of it is in the quality of the fight, not who the enemy is. You know what I mean?
Exactly. On a lighter note, can we talk about your upcoming book? Because I know that was.
Oh my God! It's funny. It's now pre-sale on Amazon. It's called The Pro-Aging Playbook. And it's funny because, as much as I've talked about before coronavirus, that this isn't a book just about beauty. It's about a way to live life. It's about how to age, and how to address the different challenges in a positive light. It's so funny now because people are asking me questions. The things that are in the book are even more applicable, even though none of us are concerned about our hair and our Botox and the fat on our thighs. So much of the book is really about how our outlook and how we deal with the challenges. And by the way, without coronavirus, life is difficult. Aging, having physical disabilities, dealing with the challenges that time brings, that's a battle enough. So much about how we conquer and succeed is our perspective going into that perspective. And that's really what the book is about. Of course, it talks about all the tricks you and I know about, and it talks about skincare and all the things in wellness, but it's really about attitude. And I think now more than ever, having a positive attitude and functionally addressing the things that are in front of us are really going to be the biggest predictor of how we come out of this.
Right. So in terms of your friends and family, are there any precautions that you're recommending in terms of supplements?
Well, you know my dad, right? Keeping him down is not an easy process, right? Okay.
Right.
So I'm trying to be a cheerleader for my family and protect them as much as possible. Knock on wood, everyone's doing okay. But we all have to be prepared. I tell everyone keep a pulse ox in the house, right? I tell everybody keep Tylenol in the house. I was never a huge supplement person, but vitamin C, vitamin D, and zinc, I think, are important. We're not getting outdoors even for that as much for that 10 minutes of sunshine. Maybe in Houston you are, not in New York. It's pouring right now. And we may not be, especially if you're sick, you're probably not eating or hydrating yourself like you normally would. So those are the basics. Even when I was sick, I stopped taking my Lipitor for a while because I was just out of it. I'm trying now to get back into the grooming of things. I was just speaking to someone, how important it is that we try and do our daily grooming. I mean, your curls are getting out of control there. Joanna's going to have to give you a haircut. But shaving, grooming ourselves, even maybe putting on makeup if that's what they're used to on a daily basis. When we're on vacation, we tend to groom ourselves less because we're letting ourselves go. We let the beard grow and things like that. But I don't really think that's the case now. And I think on a professional level, I think so much of maintaining our sanity is doing our best to maintain that grooming. And that could be whether you're putting vitamin C on the face, or you're coloring your hair, or you're shaving your armpits, or, you're brushing your teeth twice a day.
Right.
You know what I mean? So I really think on a professional level, it's important for us to remind our patients about those things, not just for the way they look, but for the way they feel.
So I've been asked a lot about, things that you can do at home, especially since all of us are on screens right now and our faces are
Yeah.
being more prominently displayed. What kind of advice are you giving your patients in terms of what they can do to put their best face forward?
Learn how to use filters.
Okay.
I really think that's it. Set up a ring light like I have now. Okay. And if you could do if you have a Facetune app, I don't really know otherwise. Unfortunately, I spend a lot of time on social media and all these things, and you learn your little tricks, and you got to do things to make yourself feel good, and then other people will respond to it. You look pretty good to me, Paul. I don't know.
Oh, well, thank you.
What's your technique at home? What do you got going there?
Just a good moisturizer, a little makeup.
This guy has stayed out of the sun since I've known him. I think that's the main thing. Okay. Hopefully we'll both be out on the boat one day soon enough down in Tennessee. And, I wish your family and everyone the best. I'm glad to hear everyone's okay. And, hopefully you guys will not have it as bad as New York. But if it does get bad, hopefully you'll be a bit more prepared too, right?
Right. I mean, I think we've learned a lot and you guys have been great in terms of sharing information. I think, unfortunately, we were, as a country, underprepared, kind of, and had a little clue when we were back in February about how significant this was going to be.
You know what? We could blame the politicians. We could blame ourselves. The fact of the matter is, coronavirus was just a word that belonged somewhere else in the world a month ago to all of us. We're busy with our practices, our family, our exercise routine, who we're going to dinner on Saturday night. Politicians and scientists, they respond to data and to polls. You know what I'm saying?
Right.
And if the public doesn't care that much, then unfortunately they don't care that much either. Very difficult to step forward and say, it's very easy in retrospect. I like to think about not whose fault it was, who it was. I try and think about moving forward. People are like, who'd you get it from? Who'd you get COVID from? I don't care. I care about how I'm going to prevent giving it to the next person. And I think we have to think about that politically to some degree also. I mean, we got to do what we have to do to get our politicians to help us out. But, I think it's about moving forward, not backwards.
Right. And in terms of hydroxychloroquine, what are your thoughts on that?
I mean, I took it, but I took it too late. I took it 24 hours before my fever broke at day 12. And in all honesty, Paul, I don't know if it was just my time to turn. I was afraid to take it. I don't know why. I mean, it's been prescribed in dermatology. It's a relatively safe medicine. But when I started having the breathing problems at day 6, I really was like, okay, I'm going to wait a few days because they're prescribing it now. The president approved it. The FDA approved it. So we'll have some data in a few days. But you know what? It's now like 10, 12 days later. We still don't have data. If this drug supposedly makes people afebrile in 24 to 48 hours and they're using it, we should have some data. And I think that's really the difficult thing, the data and the testing. I think, in New York, there's pretty good access to testing. They're not going to test everyone that got in the door. I was able to get a confirmed negative test afterwards, but it's just tough all around. It's always comes down to money and resources, right?
So in your office, will you be offering testing to see if patients have been exposed or have antibodies?
I hope so. I hope so. I ordered 2 weeks ago the antibody tests, thinking that I was going to get them a week ago, and then now they tell me another week.
Will that be a blood test?
Yeah, it's a pin. Okay. It's a pinprick test.
Okay.
And in 10 minutes, if you have antibodies, and if you have IgG, you've had recent exposure. If you have IgM, you had past exposure. And if you have nothing, well, then probably you have no exposure. You know what I mean?
And what's your sense in terms of the potential false positives or false negatives with that test?
I'm sure probably the same as the probably the same as the molecular test. But if you have a healthy person that walks into the office and they test negative, and you're protecting yourself and your staff with gloves and distance and masks, I think the chances are pretty good that you're doing what you have to do to protect yourself, the patient, and the environment. It's the only way. We're going to have to take that step out into the water where our feet are barely touching the ground. You know what I mean?
Right.
There's going to
Exactly.
be that point where we're going to have to do that. But I think between the rapid testing, and fortunately for us, we're in the healthcare community. We know how to protect ourselves. We know universal precautions. I mean, people working in grocery stores and pharmacies, I mean, no disrespect, but they don't understand the kinetics of universal precautions like we do. And don't get me wrong, a lot of doctors still don't know how to do it. But, it's difficult. And I think, hopefully we'll be in a lucky situation because we'll be a little bit more prepared than a lot of the other businesses out there getting us back to life.
Now, as you know, there's been a significantly higher death rate in men versus women. And there's some theories behind that, perhaps smoking or comorbidities. I'm just curious from your perspective, speaking to colleagues or people who have had a tough recovery from it. Do you think it's affecting men's ability to recover more than women?
I've spoken to some ER docs and some people in the field. I think statistically there's an increase in men, but I think clinically and anecdotally it's really not necessarily the case. My friends in urgent care clinics and stuff, they really haven't seen it. I'm trying to think of, I know just as many female friends and colleagues that got viciously ill as I did.
Okay.
Women live a little bit longer. Women have a higher risk of autoimmune diseases. Men have a higher risk of heart disease. Who really knows? One thing we're really noticing here in New York, which is terrible, is its socioeconomic distribution.
Right. Exactly.
It's really hitting, they're saying Black and Hispanic, but it's really about socioeconomics. It really is.
Right.
Underprivileged areas are getting hit harder. Elmhurst and Brooklyn Hospital have had the greatest challenges, and they have the highest minority population. But I think it's just about poorer living conditions, socioeconomic issues, less access to healthcare. People have a much lower threshold to go straight to the ER,
right,
and to have a doctor to call. So it's overwhelming the system, and it's really sad. So. I'm sure it's going to replicate itself in all the states to some degree.
Now, you had the pulse ox at home, and your oxygen levels were steadily dropping, which had you very concerned, obviously.
Yeah.
Your objective was to stay out of the ER, which is for good reason. For people who don't have the luxury of having an accredited facilities such as yours where they have access to oxygen and they're really struggling at home, what kind of advice are you giving them about, obviously they need to speak to their physician. Yeah.
If you have a pulse oximeter, which has become like the hottest household item right now, a lot of people have them. If your oxygen is in the very low 90s, dipping into the 80s regularly, you need medical care. If it's regularly in the high 80s or lower, you got to go to the emergency room. For people who don't have a pulse oximeter, if you're struggling to breathe and you're noticing changes, grayness in the color of your cuticles or your lips, that's emergency medical care. Ironically, Dr. Friedman, there are people with extremely low oxygen levels and don't consciously have breathing problems. That's what's odd. And I've had other patients that are hacking away, coughing and they're like making efforts to breathe, and their pulse ox is 96, 97. That's
wow.
The odd thing. A lot of this has to do is where the inflammation is. If the inflammation obviously is in the upper respiratory, you may be more symptomatic, but your oxygen levels are going to be better. A lot of people, when it's really deep, you're not having the breathing reflexes, that breathing heavy, but obviously your O2 sats are pretty low. And even when I first got my pulse ox at like day 6, I was averaging 93. And I wasn't that short of breath yet. But then, I got down to 92, 91. And when I was dipping into the high 80s, that's when I was using my oxygen. I certainly don't recommend people trying to be MacGyver and try and source oxygen. But, at the time, too, it was very early in the game of understanding who got this and who didn't. And as a physician, I knew that the doctors and nurses, they were overwhelmed. And whatever treatment protocols they had, they weren't experienced in them. They were treating this like like everybody was ARDS, acute respiratory syndrome, and pneumonia. We're learning already, information is coming out that in the early stages, they were ventilating people too early. And they were also using too much positive pressure. Okay. They're learning now to keep people on high oxygen as much as possible without intubating them. And that is better for the lungs. A lot of time earlier on, they were prophylactically putting people on ventilators just in case, because they didn't want to be in an acute situation. Now they're learning they want to push the oxygen as much as possible. And then if someone does get put on a ventilator, to make it as high concentration of oxygen and low tight pressure as possible, because it's the pressure of pushing the oxygen in and out of the lungs that's causing additional damage.
Do you guys seem to be okay with your ventilator situation there? Or is it...
I think we're caught up. My impression from the governor and from people I've spoken to at the hospitals is that no one has died due to lack of resources. Not yet. Right. And I think that's the most important thing. Because, yeah, people are saying, oh, people die of flu every year. People die of this every year. And, yes, unfortunately, we lose lives every year. But the one state that we want to absolutely avoid is being in a position where we lost a life because of unprepared resources.
Right.
And that's what we're really fearful of. And hopefully in New York, we're starting to see it flatten a little bit. We're trying to catch up. But, you know, a lot of these the predictive curves, you know, there are some that make us seem like we're doing such a great job. And there are others that make us seem that no matter what we do, it's going to be Armageddon here. I'm sure you have the same curves in Houston, right?
Right. And another issue that we're facing here, and I'm sure you are as well, is not having enough PPE masks for people on the front lines.
Oh, we got Dr. Abram on here. Thanks, Dr. Abram. How are you? And some of our peers.
And it's interesting, some of the technology that they're using to sterilize the mask in terms of, you know, some of the heat or ultraviolet. They're using different types of vapor technology to sterilize the mask. But go ahead.
I'm telling everybody, you know, a lot of the public, everybody wants their own N95s. Everybody wants their own N95s. We really have to reserve those for the healthcare professionals. You know, right. Plain surgical masks, scarves, homemade masks, those are fine for normal people, because again, you're really just trying to protect yourself from others. We really have to reserve the professional PPE for the professionals.
The other thing they're doing, I'd be curious if they're doing it in New York, is they've devised these aerosol containment boxes. Have you seen these, where the people on the front line or who are doing the intubation or the extubation, the patient is contained within this box. There's negative pressure, and it prevents some of the aerosolization that occurs during the extubation process.
Yeah, this was an issue also with the nebulizers. So a lot of people were asking me, because I was able to get a hold of nebulizers my doctor prescribed, and it changed the game for me. I was really able to open up my passages and take in oxygen and improve my pulse ox. But nebulizers aerosolize viral particles. So I tell people, if you're going to use nebulizers, it must be in a quarantined environment. Because in the hospitals, you know, every room in the hospitals were set up with like nebulizers, oxygen tank. Those are like the two main things. And you can't nebulize in a public space. It's just too risky. It's just like what you were talking about with intubation and stuff. So using the meter pumped for the albuterol, that's a little safer, but not as effective as a nebulizer. But yeah, you know, again, we're trying to protect the people on the front lines. And I really do believe that healthcare providers are getting this worse than the normal population. And I think it's just a viral load thing.
Right.
I mean, who knows? Maybe I was exposed to 10 people. You know what I'm saying? But there's no question that there are a lot of healthcare workers that are getting sick, and the ones that are getting sick are getting really sick. So anything that we're learning on how to protect them more and more. I mean, it's crazy out there.
So something else they're doing here in Houston and the Texas Medical Center is, and maybe you want to talk about this if you would like, is using antivirals. One that's showing some promise is remdesivir, which is distributed by, and they're using it for severely ill or moderately ill patients. Do you have any perspective
They're
on how that's helped?
They're using all of them in New York too. I mean, there are enormous amount of trials. You know, the sad part is we got a lot of subjects here. You know what I mean? So I do believe the FDA and the government and the medical centers are really able to do whatever they think is necessary experimentally here, because we just have the population and a desperate population. I'm just very disappointed that we don't have zero data so far. I mean, I know it's only been a few weeks, but like, I don't know. I think we would have something. And I think what people have to realize, because everyone's asking me about this drug and that, you know, fortunately for most diseases, there's several medicines out there. There's not going to be any magic bullet. You know what I mean? You can have 10 people with a headache. Some people do better with Tylenol, some better paracetamol, some people ibuprofen. Everyone's going to be different. What we hope to do is really get a armamentarium of protocols out there that we could potentially use. And maybe we'll use this protocol for people at a certain stage, or this protocol on someone who has asthma and who is at that stage. But we're only going to do that through time and effort. You know.
So let me ask you another question. This is something that I'm getting asked on a daily basis from people in the corporate world who have, you know, who are concerned. Maybe they're laying off employees. They've been asking me daily, you know, how do I believe this is going to impact patients' desires to come in for some of the procedures that we offer? You have any?
I do. You know, I opened up my practice, as did you, Paul, when you were in fellowship and stuff. We graduated residency together, like literally a few months before 9/11. And when 9/11 happened, I honestly believed that no one would ever want a chemical peel or a laser or any of these things again. And I have to say, I feel very differently than I did back then. I honestly believe that the public wants nothing more than to go back and live their lives. Now, they may be a little poorer, they may be a little wounded, but I believe, at least in the American way of life, that people want to, you know, consumerism and commerce, I think, will live. And I think people want to feel good, they want to look good, and they want to interact and play with each other, whether it's fighting or enjoying themselves. So I have faith that it's going to come back. Is it going to come back, you know, 100% right away? Absolutely not. Our economy is going to be so hurt. But listen, I think the good news for us is we've seen it already. People can't live without their basic grooming needs, like their Botox or their hair laser or their skin cancer removed, you know? So dermatology, you know, that's why my mother, the nurse, you know, my mom, why go into dermatology? Because people will go to the doctor for a spot on their skin or a wrinkle on their face before they would a pain in their chest.
Right.
You know?
It's true.
So I think for us, we're going to be pretty good. A lot of businesses are going to suffer out there. I'm sure you, as myself and all the other doctors out there, are applying for these loans that are out there. I'm really doing everything I can to hold on to my staff. I've been in practice 20 years. They're part of my family. I've had many of them that have worked for me for 15 years or so. And, you know, it's not easy to train people anyway on a logistical level. Not only do I want to protect them, but I do expect things to get busy, and I will need manpower, and I will need trained manpower and woman power. So, you know, it's not like we're not in a profession where you could just like hire and fire and hire and fire. We're skilled labor, and I think it's important that we do whatever we can to really hold on to those people that have been through us with the good times.
Couldn't agree more. Are you feeling up for doing a few questions? I don't want to take up too much of your time.
Hook me up, brother. I don't have a date. My wife doesn't want to hang out with me. She told me I'm allowed back in the bedroom in 6 months. I won't be contagious again. No, what kind of questions you got?
Is there something that you can do at home if you do not have a nebulizer?
Breathing exercises. That's really it. You know, a lot of these things going on around the internet now about what people with COPD and asthma do to strengthen their lungs. Breathing in slowly through their nose and then pursing their lips and blowing out. You could find a lot of these exercises on the internet. If you are sick, call your doctor. You can get prescriptions. Pharmacies are open.
Right. There you go.
There you go. Oh, and you got to exercise. You have to stretch.
That's great advice.
Your body. And this is true if you're actively sick, recovering, or not sick. I mean, I'm struggling every day, man. I'm walking up flights of stairs. For me to do 12 push-ups is like, I can't even tell you what 12 push-ups is, you know, for me. It's challenging, but we have to do that to keep our bodies moving.
I agree. I know you've been talking a lot about staying active, and because it sounds like a lot of patients who are suffering from this want to curl up and recover in bed, but it sounds like the more active you are, the better your chances are in terms of. Okay. Yeah. So another question about what about the pneumonia vaccine? Is there any chance people who have had that are safeguarded?
I mean, that's the talk today. You know, did people who have BCG vaccines in Europe for tuberculosis, the pneumonia vaccines, are they protective? You know, there's a lot of cross-pollination when it comes to immunity, right? We know if you stimulate your immune system with one challenging vaccine, it may cross-react with others. It may do so in a positive way. It may do so in a negative way. I don't get the flu shot because the 2 times I've taken it, I've gotten sick. So, you know, anything is possible. I certainly wouldn't rely on any information and have anyone think that they are immune. We all have to live as if we are contagious.
Right. And what's unique about your situation is you have no history of asthma or any lung diseases at all, and it hit you as hard as it did.
No. Just my only predetermined health issue is getting old rapidly. That's really it, you know. But you know, I turned 50. I was what I thought was in some of the best shape of my life. I just have high cholesterol, which I take medicine for. But you know, that's really what changed my attitude on this whole thing. And, you know, a lot of people are asking, everyone's talking about how bored they are, how frustrated they are. Man, I got to tell you, every day is as good as sitting on a beach in St. Bart's to me. I'm not like, you know, every meal is like the best meal I ever had. When you're really challenged mentally and physically like that, the world has a whole different meaning. And I hope that through this tragedy and all this stuff, that we are able to not think about what we're missing out on with the new normal, but really being able to recognize the gifts that have always been in front of our eyes. You know what I mean?
I mean, I think it's great what you're doing in terms of getting out there and talking about your experiences and speaking to other experts. I mean, I think it says a lot when, you know, you have 2 dermatologists who are sitting here talking about, you know, all these pulmonary issues. But
they want us to talk. They want us to talk about Botox and skincare. We'll slip that into that. Day will come. That day will come.
So another patient, another viewer is saying, I had pneumonia in January. Am I more at risk now? What happens if I get sick again now?
Well, you know, I'm not a pulmonologist,
right,
but I'm learning from personal experience that recovery from pneumonia is not days. It may not be weeks. It could take a couple of months. So you're certainly susceptible to pneumonia a second time if you had it recently. So you just got to take those extra precautions.
Right.
This is coming from a cosmetic dermatologist, by the way. Okay.
No, well, it's really appreciate. It was great seeing you. You look like you're looking like your old self.
Yeah, it's great to see you, Paul. Soon we'll be together again. I'll come. You'll come. I'm coming down for that rodeo.
Oh, you know, the rodeo here, they had to shut it down.
I'm sure, but the rodeo will rise again.
Exactly. You take care, my friend, and hopefully we can do this again under better times.
I hope so, man. Say hello to the family for me. I'll see you later.
You too. All right, bye, my friend.